Hi, I'm Dr. Agilan Arjunan. I'm a fertility specialist and a gynecologist from KL Fertility Center. 1 in 6 couples suffers from infertility. Many of those couples needs an IVF treatment. When you look into the reasons why the couple needs an IVF, actually 50% of those are contributed by the male partner and another 50% are contributed by the female partner. If you go back 15 to 20 years ago, we used to say majority of the reasons are female related. Only about 10 to 15% of those couples who need an IVF is male factor related. But in the last 5 to 10 years, the scenario has changed drastically. Of all the couples that's going through an IVF, 50% are male related. Now, why is that so? Why male factor infertility has increased drastically over the last 10 years? Now, I used to tell my patients, this is mainly because man has been, either intentionally or unintentionally, being poisoned over the last few years. What am I saying by being poisoned? Yeah? It's a male factor, main cause. If you look at the main causes of male infertility, many of those are environmentally and lifestyle related. This is why I say they're being poisoned. Now, let's look into it one by one. First thing is smoking. Over the last many years, we know that smoking reduces the count and also the quality of the sperm. Men may think, or patients sometimes ask, Doctor, I produce millions of sperm. I smoke for the last 10 years. Since I'm producing sperm, I still be able to get my wife pregnant. Why is that not happening? The simple answer is the men have to realize that when they're able to ejaculate or they're able to have sex, it doesn't mean they're able to make the woman pregnant. It got to do with the, first of all, count of the sperm, which is the quantity, and more importantly, the quality of the sperm. A man, a smoker, can actually produce hundreds of millions of sperm. If most of the sperms are dead or most of the sperms are abnormal, the sperm doesn't do its function, which is basically to fertilize an egg to form an embryo. This is the basic problem with the smokers, but they don't realize that. Okay, so that's the first thing. Now, the next thing is, if they stop smoking, can everything be reverted back to normal? Most likely not. This all depends on the extent of the damage that has already occurred. If the damage is severe, yes, we can do some lifestyle changes. The man can stop smoking. We can take some supplements, try to improve the production capability of the sperm, but it may not become normal. That's the reason why many of the couples with male infertility would require an IVF to get pregnant. That's the first reason. The second reason is food, what we eat. Now, nowadays we are not eating like how our parents and grandparents used to eat, and we can't. Okay, we have fast food every day, probably 3 times a day. Processed food or unhealthy diet has been shown to reduce sperm quality. Now, there's some studies have done in overseas. They have looked into sperm count and also sperm quality of a young man. They follow them up over 6 months, over 1 year. They realize that their sperm count are gradually dropping. Mind you, these are young men. They are only in the range, the age is in the range of 25 to 30 years old. Now, men, sometimes we think that there is no such thing as biological clock for a man. We always talk about female. We always warn them, now you are already about 35 years old. Now your fertility is dropping drastically. But we don't say that for men because he will be producing sperm as long as he lives. Okay, but actually there is enough evidence to support that man also has something called a biological clock, which actually starts at the age of 30. After the age of 30, their sperm count and also quality drastically drops. Okay. Now, if they follow or if they practice unhealthy diet, yes, sperm count going to drop even further. Okay. The next is obesity. Now, obesity not only related to infertility, but also related to many other health or lifestyle related diseases like high blood pressure and diabetes. Now, a man who is obese, he produces a lot of female hormones. So male hormones are being converted into female hormone, and thus it reduces the sperm production capability in him. Now, the next issue is stress. So typically couple comes in, or the man who has a poorer sperm quality will blame on stress. Now stress have some evidence to associated with poorer sperm quality and also the count. But more so when the man is stressful, it actually affects his sexual activity, which directly leads to infertility. Apart from this, alcohol consumption also plays an important role. Okay, binge drinking or too much of alcohol consumption actually known or has been proven to reduce sperm count and also sperm quality. So the man have to watch what he drinks. So I have gone through the main causes of male infertility, which are all environmental related. Apart from that, a small proportion of men actually inherit this condition. Okay, when you look into a man who produces less sperm, or scientifically we call it oligospermia, about 5% of them has a genetic defect where sperm production actually has been reduced. Now, among those men who's not producing sperm at all, we call them azoospermia. About up to 15% of those women with azoospermia actually carries a genetic defect. Now, what defect that we are talking about? We are talking about defect in his male gene, which is a Y chromosome. Okay, there are few types of defect. One type of defect, actually we can still try to retrieve sperm with a small or minor surgical procedure directly from the testicle. We're still able to get sperm. But there are other defects which actually we know that even if we do a surgery, the chances to retrieve sperm is near to zero. So when a man goes through an assessment, they come to a clinic, go through an assessment, some of them will go through a blood test to check their Y chromosome. The other implication of diagnosing man who carries this defect in his Y chromosome is if he goes through an IVF. Now, if they get a boy out of the IVF, he will pass down that same exact defect to the boy. So the boy will, or the son, will actually carry the same problem. So it's important for them to go through a genetic counseling before going through an IVF. Okay. Now, since we know what causes male infertility and we know that most of it are environmental related, so the obvious answer is going to be take care of your lifestyle. Now, that doesn't start when you're into late 30s. I tell my patient, male, or we call it fertility health, actually has to start when they're still very young. From university, from secondary school, you need to take care of your lifestyle, eat well. If you're a non-smoker, please don't start. If you take alcohol, try to stop it or take in moderation. Okay? Lead a healthy lifestyle, exercise so that you don't become obese. And you follow all this, and also probably some of you will take supplements, which I encourage to take supplements like vitamins. Now, if you follow this lifestyle, hopefully you do not fall into the pit called infertility. Now, many of us or many of the couples, we look into this or they try to make lifestyle changes once they've already diagnosed into or they already fall into the pit of infertility. Sometimes it may be too late. Now, with the current advances in IVF treatment or infertility treatment, what about older men who generally have poorer sperm count and quality? Now, as long as we can retrieve sperm from the man, we can use our current technology, or more specifically, we call it ICSI, and still make the couple pregnant. Now, when I say ICSI, or it's known as intracytoplasmic sperm injection, when we retrieve eggs from the wife, for example, we have 10 eggs. Now, we'll only need 10 sperms from few millions that older men can produce. We only need that 10 sperm to be injected into each egg, and that will give rise to an embryo. And once you transfer good quality embryos into the wife, she can get pregnant. The chances will be very good.